Hi guys, I want to talk about the 5 things that you should know to make the right decision about a semaglutide program. First, if you're trying to use your insurance with a commercial pharmacy like CVS or Walgreens, be ready to wait at least 90 days for these medications. There is such high demand for these products that it can take that long to get the medication. If you do use your insurance and your insurance doesn't cover it, be prepared to pay an arm and a leg for these medications. The only way that insurance covers these medications is if you're medically diagnosed as obese. If you go to GoodRx, you can look up Wegovy or Ozempic, and what you're gonna see is that these medications cost about $1,400 a month on average nationally. So how do you get around this? The trick is to use a compounding pharmacy. It's the same molecule with the same results, but you're not gonna pay nearly as much. There are so many bait and switch offers from doctors out there right now. The most important question to ask is, how much semaglutide am I going to get and what am I going to pay for? This is going to give you an apples to apples comparison so you know which clinic's program is right for you. There are clinics out there that will say, oh, you just have to come into the clinic once a week to get your injection. This is illegal. You can get semaglutide one of 2 ways. The first is from a commercial pharmacy with the name brand medication that we talked about earlier. The second is a compounding pharmacy. Compounding pharmacies must make medications that are patient specific. So what that means is it has to be a bottle with your name on it shipped to your home. It is highly unethical and illegal to do these programs with in-clinic shots from a bulk supply. The way they do it is they make fake patients that have names like Mickey Mouse or Donald Duck. Be sure that the clinic has your long-term goals and success in mind. If you're not worried about the end game, you're gonna start gaining weight as soon as your program's over. The weakness of semaglutide is its strength. Sometimes it works too well, especially if you're not monitored properly. You can wreck your metabolism and you can lose a bunch of lean body mass like muscle if your clinic is not taking care of you metabolically. Make sure your medical provider cares about the sustainability of your weight loss and cares not just about 4 months after you start your program, but what you're gonna look like 1 year out, 2 years out, 3 years out. Not just 4 months after you stop your program. I hope this helps explain what weight loss with semaglutide looks like. If you have any questions, please let us know, and thanks for watching.